When I first had Brooks, so that was almost 4 years ago now, oh boy, my postpartum experience was completely different than what I had in mind that it would be. We see all these highlight reels of the newborn babies and the moms that are smiling, and everybody looks so happy, and it's like it's all magical and it's gonna be good. And yet emotionally I was very anxious, super anxious. I mean, I have family close by and they're so helpful, and yet still on a day-to-day basis we can feel very alone.
When feelings of postpartum anxiety and isolation overwhelmed her, it caught Brian Michael by surprise. Yet her experience isn't unusual among new moms.
The most common complication of giving birth is mental health issues. We screen every single mom. If you've been pregnant, anybody of you that's been pregnant knows you gotta pee on a stick every time you go to a doctor's office, and they're checking you for ketones. They're checking your vitals because they're worried about diabetes, they're worried about hypertension. But like those are like 3 to 5% risks, whereas risk of a postpartum mood disorder or anxiety disorder, we're looking 15 to 20%. And the problem is we don't think of these as fatal illnesses, but they are. They are fatal illnesses. People die.
While maternal death rates have declined by more than a third since 2000 everywhere else in the world, U.S. rates have jumped more than 25%. Mental health plays a part in this public health crisis. Suicide is the second leading cause of death in new mothers, and the complex pressures of new motherhood can make it hard to seek help.
There's always the sense of, I don't know what I'm doing, I'm not sure, but there's this expectation that you should know what you're doing. It challenges you on the very core of who you've defined yourself as. Nobody talks about that.
You know what, Sarah, I agree.
That's where psychologist Suniya Luthar comes in. She wants to change how people talk about motherhood and how mothers talk to each other.
And it hit me a lot harder than I thought it would. And then, you know, when my kids get upset with it, then that's really hard.
This is Authentic Connections, a program Luthar developed to help mothers build networks of support that strengthen their resilience, their ability to adapt to adversity in a positive way.
Think of it as a book club, except that you know where women get to after the second glass of wine? We just get there automatic. We just get right to it. So it's like getting to the nitty-gritty, to the real stuff without messing around with it. And we have 3 months of that. That's pretty wild, isn't it? 3 months, once a week, where you have those real, deep, authentic connections.
As a little girl in India, Luthar set out to become a child psychologist. Her dream led her to the U.S. and to research on childhood resilience. That's where she noticed a missing piece in the science.
Basically, what child development experts would say is what kids need is for moms to function well, which is fine and good, except the story ended right there. There wasn't an investigation of, so what happens here? What helps moms to function well? So that started the investigation of understanding who mothers mommy. How do we make sure that mothers get tended themselves?
Through a series of studies, including a survey of more than 2,000 women, Luthar discovered 4 factors that boost maternal resilience and well-being.
One of them was this unconditional acceptance. I feel seen and loved for the person I am. A second was when I'm in need, there is comfort for me, dependable comfort. A third was satisfaction with friendships. And a fourth was what we call congruence. The person I am in my everyday life that people see is the same person that is deep within me. So it was basically a congruence, authenticity. I am authentic. I am myself in my everyday life. These 4 things, simple things, these are huge. Applaud that and do it. Well done.
Luthar developed a model for facilitating groups that foster those 4 factors. And then, in 2016, she tested it out on a group of Mayo Clinic health professionals who were all mothers.
They showed improvements in pretty much everything: depression, stress, parenting stress, feeling loved, and even on the stress hormone cortisol. And what's more, the benefits were even greater 3 months after the intervention was over. So this was not sort of flash in the pan while the groups are running, it's all good, and when they're done, it's over.
One of the things I really struggle with as a person is it's like, I really like meaning and depth and realness, and I feel like I have a place where I can feel those things and have those things is so enriching for me.
Brian Michael joined one of Luthor's groups out of professional curiosity. She runs a business that teaches stress reduction techniques. But she found the relief and support she didn't realize she needed.
One of the things that I would notice, which was kind of surprising after I would come home from the meetings, is how much more loving I would be, how much more patient I would be. It's like, and that wasn't intentional, like I was trying to shift that. It was just that with that experience of feeling loved and supported, my heart was more open to offer that to my own kids.
I'll tickle them. Every time you put your foot in my face, I've got my tickle hand.
It's about creating these networks that exist for women as they do this, that they can call upon like this. Say, I'm hurting, I'm sad, I'm flailing, I'm shaky. Somebody hold me metaphorically, and there that person is. And it's not fake and it's not phony, it's real, it's loving, it's gentle. So for me, God, what a gift. It's like magic watching this happen.
Lori?
Hey Nikki, how are you?
Oh, there you go. Okay, hi.
How you doing?
Now Suniya Luthar is working to spread authentic connections across the country, training other facilitators and even setting up virtual groups.
I actually think it'll be very effective in the sense that it does focus on a couple of key factors, right? It focuses on educating, normalizing, destigmatizing. And then the cool thing about her groups is also that she's pairing moms with the similar cohort. So if you have a STEM background, she'll pair them with a STEM background, which kind of also helps them have that, this is my group. These people get me. I just don't know how easy it'll be to recruit because stigma is still there, judgment's still there. I am not a priority because I'm a mom and I have to take care of everybody else. I am the caregiver. I am not the care receiver.
Removing those barriers requires the kind of change that runs deeper than raising awareness or changing any individual mom's mind.
I have patients that really needed to take time off after having a baby, and I talked to them and I was like, look, we're already struggling. Time off will help in terms of your mental health. Regardless of if you've had a history, you need that time off. And they were like, well, if I want to feed my other kids, I have to go back to work. That is just, there's no arguing that. It's not a system that is set up for you to succeed. You struggle, somehow you succeed. You struggle again when you have the second baby.
Connections are not optional. They are essential. What we all need is love. And now you've got a way that you figured out how to do it in a pragmatic, in a feasible, scientifically based way. Let's just do it. That's it.